6 things to do and 6 things to not do when healing chronic pain and symptoms. I get a lot of comments on what exactly should I be doing or not be doing to heal from neuroplastic pain and symptoms. And there are definitely some things you should be doing, and there's definitely some things you should not be doing. And so in this video, we're going to dive into it. At first, I'm going to go through 6 things you should be doing, and then we're going to go through 6 things you should not be doing. So let's dive into it. So at first, we're going to go through the 6 things you should be doing to heal chronic pain and symptoms. So number 1, you should be having here and now focus on your nervous system, emotions, symptoms, and life. When we have chronic pain and symptoms, we are sucked out of the here and now. And I get it. When I had chronic pain and symptoms, I was just completely disconnected by the end of it. But healing your nervous system, healing your chronic pain and symptoms, we need to be in the here and now. This is why all these somatic practices on the channel have a here and now focus. You need to be in the here and now of what your nervous system is doing, on what you're feeling emotionally, and what your pain and symptoms are doing. And you need here and now focus on living your life. Otherwise, we're just pulled out of the here and now, and we're not even able to know what our body's telling us, what our nervous system is telling us. So, the first thing you should be doing is here and now focus. The second thing you should be doing is accepting and allowing where you are at. Every morning when I get up, this is one of the first things that I do. I'm human. I have bad days. I know all the techniques, all the strategies for healing, but I have bad days. I have days that I wake up angry. I have days I wake up anxious. And the odd time, I don't really have chronic pain anymore, I might wake up with a symptom. It's known to happen now and then. And we need to accept and allow where we are at. Give permission. Give yourself permission to be a human being. What I see people doing is they're trying to force themselves to be a certain way, to feel a certain way. That's not going to help you. There needs to be an accepting and allowing of the state of your nervous system, your emotions, and what sensations you're feeling. This is one of the starting places where real healing work can take off. Number 3, consistent healing work in the form of small steps. We want to make small steps forward. I've seen people be way too intense with the work. They're doing somatic tracking 30 times a day. They're trying to regulate their nervous system every waking moment. It's too much pressure. We need to be consistent with the work. All of the strategies I discuss on this channel, you need to be consistent with it, but small steps. What's something a little bit more you can do today to better your chances of healing? The more small steps you get, the more momentum you're going to start to take off with. So don't do nothing or do everything. Make small steps forward. Make a commitment to doing one thing more to progress your healing forward. Number 4, allow your healing to unfold in the beautiful way it should, and do not compare it to others. One of the questions I get a lot is, how long did it take you, Tanner, to heal? To give you context, it was about 4 months where my symptoms are no longer chronic, and about another 4 months for me to move my body. But I am careful to say that to people because everyone's nervous system's different, everyone's brain is different. If you start comparing yourself to other people and where you should be, this is going to take years upon years upon years. And so do not do that. Accept how your healing is unfolding. I always talk about it with people. It's not a journey from point A to B. It's an adventure. We don't know exactly where we're going. We're going on a healing adventure. I know adventure, chronic pain, chronic symptoms, it doesn't really link. But it is an adventure in the sense that we don't know where we're going, what we're going to find, what we need to work on. So you have to give yourself the space to allow your healing to unfold the way it needs to. Number 5, slow it down. You need space to heal. You need space to heal neuroplastic pain and symptoms. If you're making your life too busy, your healing work too busy, too fast-paced, you're not going to heal because your brain and nervous system is going to be in this high sympathetic fight or flight mode. So slow it down and give yourself space to heal. And number 6, allow yourself to not resist your thoughts, but shift towards safety. Negative thinking, fear thoughts, obsessive thinking, despairing, hopeless thinking. This will perpetuate our chronic pain and symptoms. But what I'll see people do is they'll start resisting. They don't want to think a certain way. So they're trying to resist their thoughts. But it's like if I told you don't think of a purple rhinoceros, it's the first thing that came into your mind. And so we're not resisting, we're shifting. The thoughts are going to be there. Our mind's always thinking. And when we're dysregulated in our nervous system, story follows state, and the story is going to be one laced with fear. But if we can shift cognitively, behaviorally, emotionally, somatically towards a sense of felt safety, towards connection and being in the here and now, those thoughts will naturally shift. And now let's go through the 6 things you should not be doing to better your chances of healing. Number 1, do not force emotions. Lots of people, when they start to embark on a mind-body journey, think, I have all these suppressed emotions. I'm resisting my emotions, so I need to feel them. So they're trying to force themselves to have this big cathartic release where they're feeling everything. That's going to create a lot more danger in your nervous system. A lot of times it's outside the healing window. The healing window is a window where we can tolerate the sensations of emotions and sitting with them. But if they're too intense, it's going to actually cause more damage, cause you to feel more in danger. So you want to be cautious with this. I'm all for people approaching emotions, working through things in the past, working through trauma. But if you're always forcing yourself to feel these really difficult things, it's going to put your healing back. There's a balance to this that you want to be aware of. Number 2, don't force calmness. Now, this is the other end of the scale. I'll see people realize that, they need to feel safe. And people equate calmness with safety, which those things don't go necessarily hand in hand. You can feel safe and have anxiety. You can be present within your body, have a gentleness with it, have a compassionate stance with it. But what I'll see people do is they're trying to force themselves to be calm all the time. Your nervous system was not always meant to be calm. And if you force yourself to be calm, you're actually going to get more fight, flight, freeze, shutdown energy. So yes, we're doing practices, and there's practices on this channel to help you feel calm, but don't force yourself to be calm all the time. Number 3, don't force yourself to do too much healing work. This is another downfall that I'll see people make, is they're doing too much. They're doing too much somatic tracking, too much challenging of their thoughts, too much nervous system regulation, too many life changes. It doesn't mean you can't get to all of it, but doing healing work 5 hours a day is not necessarily going to help you heal faster, and it's going to keep you in that sympathetic fight or flight zone. So be cautious with this. Don't be forcing yourself to do more healing work. The point of this healing work is so that you get more in touch with your nervous system. You get more in touch with how you feel in your body and what you need, and you can take cues off your body and listen to it. It's not to just have this template and force yourself to do 4 hours of somatic practices and brain retrainings a day. Number 4, don't force yourself to meet a healing deadline. I've seen this many, many times with people, whether it's comments on the channel or whether it's people that come to see me. They have a deadline, whatever it is. Maybe it's an event, maybe it's just a date they made up in their mind, but they have a deadline of, I need to heal by this date. That's not going to go well. That's going to create a lot of pressure, a lot of intensity, and it's going to cause a lot of dysregulation. And then you're going to track yourself intensely. And if you're not meeting that deadline, you're going to panic or you're going to shut down. So please, people, do not set a healing deadline. It's not going to help you. It's going to hinder your progress and actually really slow things down. Number 5, Don't force yourself to do too much physical activity. I'm all for exposure. Graded exposure is needed to heal neuroplastic pain and symptoms. We need to slowly, gently, and with a sense of safety, start to use our body again. We can't heal by avoiding. But when people learn about a mind-body approach, they realize their body's not damaged. They're actually okay. And that their body's capable of doing anything and everything. I remember that feeling. It felt great. But then what people will do is they end up doing way too much physical activity. And it's not that it's damaging their body, but their brain panics. It's like, oh, we've thought this was not safe for so long. And now they just went and ran 5 kilometers when they've barely walked around for 2 years. It's not that you're damaging your body, but your brain's going to panic and then you're going to have a pain or symptom flare. So it's a balance. I don't want people to go too slow with the graded exposure, but I definitely don't want people to go too fast because it's going to cause you a lot of setbacks. So slow it down and have a balance with the graded exposure work as you're starting to use your body. And number 6, don't force your thoughts to go away. Figured I hit on this one again. We just talked about it, of what you should do. You should shift towards safety. But I just want to emphasize this again. Don't try and force your fear thoughts to go away. Don't try and force your hopeless thinking to go away. We want to be aware of it, attend to it, re-examine it, understand it's probably not true or helpful, and then shift towards a sense of safety. The 3R skill on this channel that comes from Pain Reprocessing Therapy is great for this. I'll link it to the top and down below. Check that out. It's going to help you so that you're not trying to force your thinking to change. So I hope this video was helpful. Please put your questions or comments down below. Hit the like button, subscribe to my channel, and I'll talk to you all later. Take care.